2020. Good morning, good afternoon, and welcome everybody to this virtual press conference with WHO in the Western Pacific region, focusing on COVID-19. I'm delighted to be joined today by, of course, our Regional Director for the Western Pacific, Dr. Takeshi Kasai, as well as our Regional Emergencies Director, Dr. Babatunde Oluwakure, and our Coordinator for Essential Medicines and Health Technologies, Dr. Socorro Escalante. We are going to start the press conference today with an overview of the current situation in the world, and most particularly in the Western Pacific region, from Dr. Oluwakure. Please go ahead and prepare the presentation for sharing on screen. Thank you very much.
Thank you very much, Chair. Okay, I would like to present an overview of the global situation, as has been said, and then also to look at what is happening in our region and how we, and some of the challenges that we are likely to face. Next slide, please. So this initial slide shows the global situation overall. The bars indicate the cases in each of the 6 WHO regions by color, and the solid line represents the deaths that we are seeing globally. Now, you will note that the top bar, this is the Americas, and continues on an upward surge, and also our in Europe and Southeast Asia, but you really cannot see the Wipro bar, which is trundling along at the bottom of the figure, but I will bring that into sharper focus a little bit later on. On the next slide, this shows a map of the world, and this again illustrates the point that we are seeing darker colors, which represent more cases per million population in Europe and in the Americas, and particularly the USA. And our region has much lighter colors, indicating less cases per million population in the last 7 days. And on the next slide, you will see this provides some information. The next slide. This provides some information in terms of the overall number of cases globally as of the 15th of December. And the more updated information you can find on our website, but 72 million cases and 1.6 million deaths associated with COVID-19. And we can then also have a look at where we are seeing the largest increases and which WHO region accounts for the greatest proportion of cases. And there you can see very clearly the Americas accounting for the greatest proportion of cases, and Wipro actually accounts for the least. I think it's around 1 or 1.2%. And if we then go to the next slide, this now focuses on our region. We still have less than 1 million cases reported as of the 15th of December. And that should be about 972,368 confirmed cases, with 18,420 deaths. You will note the broken blue line is our what we call 7-day moving average, and this is currently showing an upward trend at the moment. The green line relates to the Philippines, which is coming down. And then we can see the Republic of Korea, Japan, and Malaysia trending upwards at this time. On the next slide, the next slide just really to illustrate which countries are moving in which direction, and you can clearly see where the countries are. Japan, Malaysia are trending up, Philippines down, Republic of Korea also going up, and China having a fairly flat line. Now, when we look at this sort of trend in the epidemic in various countries, we can really group these into four groups. And if we look at the next slide, this is where we look at those four groups or four categories. One of those where we see the trend continuously increasing. Other categories show that initially there was an increase in trend, but then this was the outbreak or the epidemic was brought under control, but is now surging again. And then in category 3, we see sporadic cases, and these are in countries where these are mainly due to imported cases. And we finally have a fourth category, and that is no confirmed cases. And we have 12 countries and territories in the Pacific where that is the case. Now, when we look at how the cases are distributed, the next slide will show you an age distribution, age and sex distribution. And in that, the blue bars represent males and the pink bars represent females. On the left-hand side, these are cases, and on the right-hand side, these are deaths. Now, you will note that the greatest number of confirmed cases are occurring in those from the ages of 20 up to 59, and the greatest number of deaths are occurring in what we might call the elderly population, or those over the age of 80. This is of real importance because when you're looking in the earlier days, we had most cases were occurring in the older population. Now we are seeing more cases occurring in the younger population, and there is information which informs us that some of this may be due to low compliance with non-pharmaceutical interventions. It might also be due to increased mobility amongst this population as a result of relaxation of non-pharmaceutical interventions. And other data also shows that there appears to be a low level of perceived threat in young people, and this may suggest complacency to basic non-pharmaceutical interventions. So my last slide now talks about just a very select number of our current and future challenges. Suppression of transmission of the virus, as well as the COVID-19 vaccine. Clearly, the virus is still circulating in other areas and countries, and therefore there is a need to continue to have early detection and suppression of the virus, and in that case, ensuring that we have adequate laboratory testing, that we have contact tracing, that there is also isolation and quarantine as appropriate. We must continue to implement and follow scalable public health interventions, and this is very, very important when we start talking about the availability of the vaccine. So the vaccine itself is not a silver bullet to end COVID-19, and there is no room for complacency. So we must remain vigilant, continue to remain vigilant, continue to comply with our public health interventions. We should also potentially look at strategies which can inform and support younger population to cope with public health interventions and to manage those appropriately. And then finally, of course, with the COVID vaccines itself, we have multiple candidate vaccines. And so this is clearly something that is going to challenge our regulators as well as program planning. And part of that is ensuring that communication about what the vaccines can and cannot do and what their purpose is fully provided, and we manage disinformation and community expectations. And that is the end of my presentation. Thank you, Chair.
Thank you so much, Babatunde. That was a really great introduction into the current situation in the world, and indeed more specifically here in the Western Pacific region. It's now my pleasure to hand over to Dr. Kasai to give us some remarks to get this started before we begin the question and answer portion of the press conference. Over to you, Dr. Kasai.
Thank you, Reeve. Good morning and good afternoon to the journalists and others across the region joining us online. You may have watched the forum earlier this morning that we convened jointly with the Lancet COVID-19 Commission. Many interesting points were made there by speakers from across Asia and the Pacific. As 2020 come to a close, we've been reflecting on the response to COVID-19, in particular, how countries and areas in this region have managed to keep numbers comparatively low, lessons that can help in the year to come, and what each of us needs to do to minimize the illness, death, and disruption that this virus can cause going forward. As Babatunde mentioned, the COVID-19 situations in the Americas and Europe is incredibly challenging for people and the governments there. In this global context, the Western Pacific region, our region has been comparatively fortunate. While every country has had a different experience of COVID-19, overall, the impact in the Western Pacific has been less severe than elsewhere. More than a quarter of the people on Earth live in this region, but to date, we've had just 1.0% of confirmed cases recorded globally. But this doesn't take away the fact that it's been a year of unprecedented challenge for people in this region. Not for a moment. It has been devastating for thousands of families who lost loved ones. Incredibly difficult for countless and challenging for children. Whoever you are, wherever you live, as long as the virus is circulating somewhere, we all remain at risk, and we must keep preparing for the worst case scenario. In this regard, I want to make two particular appeals today. My first appeal is to younger, more socially active people, maybe those under the age of 40. I know how tired you are of this pandemic, and I understand that anxiety, fears, and uncertainties you're feeling, the disruptions to your lives, and then difficult choices you're having to make. Some of you may not even feel particularly vulnerable to this disease. You might think that even if you get infected, you won't get very sick. But truth is, you can. And aside from your personal vulnerability, I urge you to think about those who may be at higher risk of severe COVID. If you catch the virus, you could unknowingly pass it on to your parent or grandparent, your neighbor or friend with an underlying condition. I also urge you to think of health workers. Perhaps you have a friend or relative who's a doctor or nurse. They have been working day and night for almost a year. They are exhausted. And so please do everything you can to avoid infection for yourself and for everybody around you. By following the advice of health authorities, you can directly contribute to protect the lives of people in your community, and in doing so, to reviving your societies and economies in 2021. I also wanted to appeal to the government across the region please add additional layer of surveillance that picks up early signs of cluster of infection among those groups that is difficult to catch with the existing system. My second plea is related to vaccines. The news of COVID-19's vaccine starting to roll out in the United Kingdom and USA is very promising. There is some light at the end of a long tunnel. But these vaccines are not a silver bullet that will end the pandemic in the near future. The development of safe and effective vaccine is one thing, but producing them in adequate quantities and reaching everyone who needs them is another. They will initially only available in limited quantities, and high-risk groups should be prioritized first. This means that, tired as we all are of this pandemic, we must stick to the actions and behavior which protect not only ourselves, but also those around us. Hand washing, mask wearing, physical distancing, and avoiding places that have a high risk of transmission. So as we prepare to mark important religious and cultural festivals like Christmas and New Year, please remember that the best way to show love and care for those in your life is to not give hug or gather in large groups the way you might normally do. I know this is difficult, but for now, we must keep making the choices that will reduce transmission of the virus and protect our families and our communities. By doing so, we can go into 2021 with hope. Thank you very much.
Thank you so much, Dr. Kasai. We are now going to get started with the question and answer portion of this virtual press conference. We've received many questions already in advance, and of course, we're going to try to get to as many as we can, as well as any that come in during this virtual press conference using the chat function. Let's get started with a question that we have from Jenny Le Ravello at DevEx. She asks, are there timeline projections for when countries in the Western Pacific can expect COVID-19 vaccine rollout? I would like to ask Dr. Kasai to make some initial remarks, and perhaps then we can have some follow-up from Dr. Escalante. Go ahead, Dr. Kasai.
Okay, thank you very much for this question. Actual rollout at the country level is a complex and needs to go through several steps, such as registrations or market authorizations and logistics preparations on the ground and training for the healthcare workers and set up mechanism for pharmacovigilance. Some countries in the Western Pacific, I'm aware that they are start rolling out vaccines in the coming few weeks, but most of other member states in the region rollout might occur mid or late 2021, next year. WHO is working with the partners through the Access to COVID-2's accelerator and its vaccine pillar COVAX to speed up the development and the manufacturing of a safe and an effective vaccines, and also to ensure that there is a fair and equitable access to this vaccine for all countries. If the right scale and then the type of investment are made, the end of 2021, next year, should see adequate dose to vaccines, should have adequate doses to vaccinate a high priority population in all countries around the world. There is some uncertainties, and there is some unknowns but we now need that commitment. In the meantime, we WHO, along with all the partners, together with the partners, will continue to help our member states, countries, in preparing for the operations for the vaccine. Over to you, Liv.
Thank you, Dr. Kasai, and over to you, Dr. Escalante, for perhaps a few additional remarks.
Thank you so much, Liv. In addition to what our regional director has already mentioned, it's important to emphasize that most, if not all, the countries in the Western Pacific region are a part of the COVAX facility. And within the COVAX facility, we are expecting the vaccines will be coming in on the second quarter of 2021. So that target remains, and we hope that the COVAX facility will be able to roll out the vaccines to all countries by that time. We are, of course, aware that there will be vaccines that might be coming ahead of the COVAX facility, and that would be dependent on country per country in terms of their readiness. In terms of the preparation of countries, the RD already mentioned that there are several systems that needs to be in place to ensure that the countries will be ready to receive these vaccines. And WHO and partners have been working with countries to develop these systems, including the national, starting with the national vaccine deployment plan, looking at the regulatory processes, their cold chain, their pharmacovigilance and safety monitoring system.
Thank you so much, Dr. Escalante. Next, we have a question from Red Mendoza from the Manila Times. He asks, the Philippines government with the private sector has signed an advance payment deal to get vaccines for at least 1.5 million Filipinos. What does WHO think of government and the private sector doing deals with vaccine manufacturers who are yet to complete clinical trials or get regulatory approval? I'm going to ask Dr. Kasai again to make some initial remarks, and then we'll come here for some additional comments from Dr. Escalante.
Sure, Liv. Actually, I don't have a specific information in relation to the question raised about the Philippine vaccine, but let me answer in a general way. We consider vaccine as a global public good, as many countries does. There has been a significant effort in expediting its development and manufacturing, as well as in developing a mechanism to share equitably. And no country is safe until all country is protected. And we are aware that there has been effort by many countries in securing a vaccine, and some of them have actually reached agreement before vaccines are actually available. But even those countries reach agreement, they will only use vaccine after its safety and effectiveness is being validated. And WHO continues to encourage that those vaccines shown to be safe and effective and then authorized for use. All countries receive doses in proportion to their population size to immunize the high-risk priorities groups. Liv, if you don't mind, I would like to ask my colleague, Dr. Escalante, to explain more about the information on safety and effectiveness. Over to you, Liv.
Absolutely. Thanks, Dr. Kasai, and over to you, Dr. Escalante.
Thank you so much, RD and Liv, and thank you so much for the question. Again, as emphasized by our regional director, even if there are already advanced commitments in terms of procurements of countries, it does not mean that we are going to skip the processes and the steps to ensure that vaccines are going to be safe, efficacious, and of good quality. In countries, the national regulatory authorities are undertaking the evaluation of vaccines, all products that are going into the country, and the national regulatory authorities are guided by global standards and guidelines on how to evaluate these vaccines. So again, the very brief answer is that our national regulatory authorities will take care of the proper evaluation of vaccines that will be coming into the country. In addition to that, I would briefly also mention that WHO has also established some global platforms to assess the safety, efficacy, and quality of the vaccines, including the emergency use listing, wherein the new products that are coming during the clinical development are already being assessed by WHO, as well as assessment of the product after they are licensed, which is our pre-qualification procedure. To ensure that the assessment is going to be stringent and robust, WHO involves national regulatory authorities and experts around the world to evaluate these vaccines. And so that after this evaluation, the countries can rely on the results of the evaluation of WHO to ensure that vaccines that would be coming into the country will be safe and effective and safe for the use of the population.
Thank you so much, Dr. Escalante. And we're going to stay with you actually for the next question, which is also from the Manila Times. How is WHO ensuring that vaccine clinical trials in the Western Pacific will follow ethical standards, including informed consent? This comes as the Philippines is still reeling from Dengvaxia a few years ago. Thank you, Dr. Escalante.
Thank you, Liv. We are aware of the concerns of the people in the Philippines regarding vaccines, particularly after the issues of the Dengvaxia. Gaining people's trust about the safety and efficacy of vaccines is very important, not only in the Philippines, but in all countries in the world. And it is very important to build trust in immunization programs, not only with the vaccines for COVID, but also with routine immunizations such as polio, measles, and rubella, because we know that all these vaccines are going to protect and save lives. The media actually can also help and play an important role in supporting the delivery of these critical immunization services by highlighting the value of the vaccine. WHO continues to work closely with national and local governments across the region to communicate and engage with communities about the importance of vaccines and the importance of the regulatory processes and other mechanisms in countries to ensure the monitoring of the safety of the vaccines. As we all know, vaccines are approved for use by national regulatory authorities who are responsible for the quality control and the assessment of safety and efficacy, as we have already mentioned. WHO, particularly for COVID-19 vaccines, has published the target product profiles for COVID-19 vaccines, which describes the preferred and minimally acceptable profiles for human vaccines, including safety and efficacy. And these target profiles are also followed and monitored by the national regulatory authorities. Now, in terms of clinical trials follow very strict scientific and ethical guidelines in the design, conduct, implementation, and monitoring of the results. And the national regulatory authorities and scientific bodies have established mechanisms to follow these standards, such as, for example, we have the review boards in countries as well as ethical committees in countries, particularly for the COVID-19 vaccines, which are um, being part of the solidarity trial. And we know that Philippines is a part and is actually going to be a part of this solidarity trial. The WHO has established a global governance mechanism composed of experts and regulators around the world to oversee the clinical trial in the Philippines. Thank you, Liv.
Thank you, Sok. And that's actually a perfect segue into the next question. So we won't give you much of a chance to catch your breath. We have a question from Jovic Lee from the Philippine Inquirer about the Solidarity vaccine trial. which is expected to start this month, is the question here in the Philippines, or if not, when is it tentatively scheduled, and are there any updates on which candidate vaccines will be used for the trial? Back to you, Sok.
Initially, the Solidarity trial was targeted to start in October of 2020. However, as these are new products, so there have been a lot of challenges that are faced, including, for example, the prioritization of the types of vaccines that will be included in the clinical trial. So there is now a new target for the start of the clinical trial, and that will be January 2021. The Philippine government has had a meeting with our headquarters yesterday to look into this new timeline. And there are two components that we need to consider before the clinical trial will start. As I have said, it's important for our experts at the global level to ensure that the appropriate vaccines will be prioritized and selected for the clinical trial. And the second component, it is also important for the country to prepare their systems to conduct the clinical trial. Again, one is that the regulatory process is in place to look into the products that will be used for investigation. The ethical boards and the national review committees will be functional to ensure that the conduct, consent, and ethical procedures are followed. And third would be the identification of the clinical trial sites, as well as the recruitment of subjects or participants in the clinical trial. We understand that the Philippine government has been working very, very hard over the months on all the components and the committees that will be taking care of all these elements of the clinical trial has been established. So yes, there is a little bit of delay, but we are very positive that the processes both at the global level and at the national level are moving.
Thank you so much, Sok. And for the next question, we're going to give you a chance to catch your breath, and I will pass this one to Dr. Oluwakuri. So the question comes from the Yomiuri Shimbun in Japan. It's about the international health regulations. The IHR require member states to inform WHO within 48 hours when they implement health measures that can interfere with international travel. How many countries and areas have informed WHO of these measures so far? Over to you, Babatunde.
Sorry. So we've received 133 notifications from countries and areas, and these include notifications based on the changing circumstances in countries. While not all have been received within 48 hours, the majority have been received within 48 hours, and Japan is one of those countries that has notified within the appropriate time period. And we continue to, of course, work with our member states in order for them to have an avenue to continue to provide information for the global community regarding COVID-19. Thank you very much.
Thanks so much, Babatunde. The next question we have is from Ta Kung Pao from Hong Kong, SAR, China. The question is, what is WHO's assessment of the current epidemic in Hong Kong? Should Hong Kong conduct mandatory universal testing? What advice do you have for the control of the current epidemic in Hong Kong? Back to you, Babatunde.
Thanks very much for that question. So as you would have seen in my presentation, we have countries and areas within the region which continue to be at different stages of the epidemic. Now, several countries and areas are reporting increases in cases, as well as localized, or what we term to be localized community transmission. This highlights the need for decisive localized response that focuses on testing, isolation of cases, contact tracing, as well as quarantine. And countries need to adopt a long-term mindset and approach when this happens. And this includes being prepared to respond to new clusters of cases, which we see occurring as a result of transmission. We understand, of course, that there is fatigue in relation to this, but the virus does not rest. And so therefore we need to continue with our responses, ensuring that they are implemented consistently, because the virus can surge back very quickly and we need to be prepared for this to happen. Thank you very much.
Thanks so much, Babatunde. We have a question from Brian Badmirowski with the Khmer Times. What criteria and mechanism will WHO employ to approve a vaccine for world use? One back for you, I think, again, Dr. Escalante.
Thank you so much, Liv, and thank you so much, Brian, for the question. So in terms of criteria, we have what we call a target product profile. So these are the characteristics or attributes of the vaccine that are ideal to be met for a vaccine that will be registered and used for the population. And this target profile again has been recommended through a series of consultation with experts and regulators around the world. The target profiles include one, that the vaccine should or ideally could be used for all ages, and it is suitable for administration to pregnant and lactating women. That the vaccine should be safe enough that the benefit over the risk is favorable, and that the adverse events will be mild and transient, and that the vaccine should not cause any serious adverse event. The target profile is the experts are also recommending that ideally the vaccine would be the efficacy of the vaccine would be ideally 70%, and then that the vaccine as much as possible could be given in a single dose, but minimally it should be given at no more than 2 doses. So those are the criteria that our regulators and experts around the world are considering. In terms of mechanisms to employ to approve the vaccine for the world to use, I mentioned a while ago about the platform that is being used by WHO, that is the emergency use listing, as well as the pre-qualification. But also, again, there are standards for pharmaceutical products approval that has been provided by WHO, and these are being used by the national regulatory authorities to assess their vaccines. So aside from the target profile, for example, there are standards for good manufacturing practices, and that the national regulatory authority will have to ensure that the quality of the product is to a standard, that the good manufacturing practices will have to be inspected and ensure that the quality of the products are up to standard. So those are the mechanisms that are in place to ensure the approval of vaccines.
Thank you so much, Sok. We have another question, I think, that will come back to you. A lot of questions on vaccines, of course, today. This one comes from Carmen Pound from Politico. Which countries in the region are preparing to roll out vaccines? How are they preparing to do that? And can you give a few examples of which candidates they're planning to use? If you can respond to that one, Dr. Escalante, that would be great.
Thank you, Liv. I would say that all countries in the region are preparing very, very hard to receive and roll out of the vaccines for COVID-19. And WHO is working with partners, including UNICEF, to get the countries prepared, as we have already mentioned, in terms of the regulatory processes, the delivery of the vaccines, the cold chain, the safety monitoring, and pharmacovigilance. So these are all elements that we are looking at. The way that we are moving is that WHO has come up with an assessment mechanism to look at how, if the systems in the countries are in place and are functional. But in addition to that, the Western Pacific region teams have been working more in detail, not only on the assessment, but convening meetings with our national counterparts, including the National Vaccines Program and the national regulatory authorities, to really understand how their systems are working and what would be the gaps and challenges that they are going to meet. And so even as early as this time, we are already able to identify what would be the potential bottlenecks, and we could already address those early before the vaccines will come. The Western Pacific regional teams are working with countries to finish this deep dive assessments before the end of December of this year. In terms of what types of vaccines will be rolled out, we still do not know. Again, our expectation for the COVAX facility will be coming on the second semester of 2021. We are aware that many countries in the region are also looking at some bilateral arrangements or looking at what products are moving into the market at the earliest possible time. But at this point, we could not specifically say what would be the vaccines that would be coming out in the next few months.
Thank you so much, Sok. Another question now on vaccines. This one from Renee Iosefa from TV1 News in Samoa. In a past press conference, you mentioned that the Pacific may get a vaccine by the end of 2021. With the new developments, how early can Samoa and other Pacific Island countries get these vaccines? And are we looking still at the same time frame as previously mentioned? Over to you, Sok.
Yes, we are still looking at the same framework again in terms of the COVAX facility, that second semester of next year. Of course, we are also very pragmatic that there may be some mechanisms where Samoa and other countries may be receiving vaccines, such as, for example, donations or other bilateral agreements, and those can potentially come ahead of the COVAX vaccines.
Thank you very much. The next question we have is from NHK World in Japan. The question is, WHO has given credit to Japan for its approach to contact tracing and other response measures since the beginning of COVID-19, but the number of cases rose to its highest level this week. How do you evaluate the current situation in Japan, and what further measures does the country need to take to stop the spread of the virus? Can you give us a response to this one, please, Babatunde?
Thank you very much, Liv, for the question. I think we should recognize that our member states are all at different stages with this particular pandemic, and that all efforts are being made. Now, when we look at the situation, and I think it's not just Japan, but in other member states, we need to remember again that this is about early detection and suppression of the virus and ensuring that transmission is minimized. And this again would require us to support the early identification of cases, laboratory testing, contact tracing, isolation, and quarantine where necessary. We believe that Japan is carrying out all these measures as appropriate, and we continue to support them in this regard. Thank you.
Thanks so much, Babatunde. The next question is from Reuters, but we have actually a number of similar questions, all revolving around the planned international delegation to visit China and look at the origins of the virus. Could you tell us a little bit more about that, please, Babatunde, the latest information available? Thank you.
Thank you very much for that, Liv. So WHO has published the names of the international team that are scheduled to visit China with regards to this. WHO continues to contact China and to discuss this the international team and the places where they visit. And these meetings are, of course, important for us to understand and get an overall picture of how the investigation will go. Now, our understanding at this time is that China is welcoming the international team and their visit, and that this is anticipated, as far as we are aware, to happen in early January. And this will, of course, depend on obtaining the results of some other tests that are being carried out initially. Thank you.
Thanks so much, Babatunde. The next question is coming from Julie McCarthy with National Public Radio in the US. She asks, how concerned are we that developing countries stand to be disadvantaged by rich countries that have cut deals to get enough vaccine to cover their populations more than once, sometimes up to 5 times the number they need? How damaging is this to global health and COVID-19 outcomes, and what can WHO do to make this more equitable? Over to you for this one, Dr. Escalante.
Thank you so much, Liv, for the question. I think first of all, we need to set the very fundamental principles that are already mentioned by our regional director in terms of access to vaccines. One is that vaccines is a global good. And second, that all countries, regardless of their development stage and economic status, should have access and share to the products and vaccines once they are made available. And to operationalize these principles, WHO, Gavi, and other partners has established the COVAX facility, which is the first step towards this direction to ensure that the resources are pooled to procure the earliest possible vaccines that could be allocated equitably to all the countries. So we know, of course, again, that there are many countries that are already getting into bilateral agreements and advanced purchasing commitments at their level, but we will continue to rely and advocate for the solidarity and benevolence of countries to ensure that all, even the countries with lower economic status, would have an access to vaccines at the same time as much as possible with the developed countries.
Thank you so much, Sok. We have another question coming from Marianne Benitez with the Hong Kong Standard. She asks, if mass vaccination isn't happening until the end of 2021, will people continue to have to wear masks and physically distance and wash hands for the next 12 months? How can WHO and governments ensure people keep it up, especially as fatigue sets in? Over to you on this one, please, Babatunde.
Thank you very much, Liv. So this is really a very good question. So mass vaccination clearly will not stop the virus. We actually need to continue to maintain the public health interventions, which have now become part of what we would call the new normal. And so hand washing, social distancing, wearing of masks, and so on are a few of these features. Member states, of course, will need to also continue to do as much as they can to identify cases early, continue to do contact tracing, quarantine and isolation, and other measures associated with that. How do we ask people to continue to do those in the onset of pandemic fatigue? I think we should recall again that the virus itself will continue to be present and will continue to affect us going on into 2021 and possibly beyond. Member states will need to find ways in which they can support their populations, particularly young people, in order to ask them to comply with these particular measures. Some of those may include finding alternative ways to have gatherings, including going more virtual with meetings, having a virtual family parties, and also trying in other ways to ensure that people are still able to socialize, but doing so safely. In particular, they would also need to advise them to avoid the 3 Cs, and so congested places and also establishments which are noisy, where you would have to actually maybe remove your mask or otherwise be unsafe in an environment with many people around. And so there are measures. We need to also look at this on the basis of what does the evidence show us that works, and also use that again to tailor messages for our various populations in order for them to understand how we can continue to maintain this. Now, I think it is also, as Adi has said, we also need to do this in order to protect not just ourselves, but in order to protect our families, to protect other individuals, as well as our communities and our businesses. Thank you very much.
Thanks, Babatunde. We've got a question from Fatima Valente with Macau Radio, TDM, asking about the approach to vaccinating particular groups, in this case, migrant workers. She asks whether governments should provide vaccines for this group, and should it be free of charge? Over to you, Dr. Escalante.
Thank you so much, Liv. The vaccination would need to be a part of a broader public health goal. And for the COVID-19 vaccines, our aim is to prevent morbidity and mortality, protect the health system, and prevent social and economic disruption. So within this broader public health goal, the WHO and the COVAX facility has came up with 3 levels of prioritization. The first one is our healthcare workers, particularly again to ensure that our health systems will continue to function, and because they are on the front lines. Second would be our elderly population, as well as those with comorbidities or some underlying conditions. Beyond that, the countries could prioritize what would be the population that they would be considering high risk, including, for example, migrant workers, but that is going to be decided at the country level. So WHO again has a guidance on how we are going to determine the allocation of the vaccines within countries and across different population, again based on the elements of our broader public health goal, and second is based on the element of equity. So long and short answer is that we have very basic guidance for allocation in terms of the priority population, but beyond that, countries could make decisions based on their context.
Thank you so much, Sok. And staying in the same kind of broad themes, can you tell us a little bit more? This is a question, I should say, from Heba Musa with CNN. Can you tell us more about the global vaccine distribution plan and WHO's role within it? How are we cooperating with the manufacturers? What is the plan for distribution, and which countries are going to get it first? Back to you, Sok.
Again, the mechanism that has been established for the global vaccine distribution and allocation is the COVAX facility. And in the COVAX facility, it is a collaboration by WHO and Gavi and other partners. But within those partners, the pharmaceutical industry is included, particularly those involved in the research and development. And there are several candidates that are supported by CEPI that might be included in the COVAX. So in terms of collaboration with the industry, that has been within the frame of the COVAX facility. In terms of allocation, again, the COVAX facility intends to first target the 20%, first 20% of the population of each country based on the prioritization that I have already mentioned. Now, the question into which countries is going to receive first, again, the basic principle is for all countries to advance at the same time in receiving the first available vaccine. So it will be a proportionate allocation of the first available vaccine that will be distributed and allocated to the countries that are a part of the COVAX facility.
Thanks so much, Sok. We have a question that's come in from Wellington asking if there are any lessons for our region from the initial rollout of vaccine in the UK in terms of approaches to immunisation delivery and expectations about adverse events. Can you answer that one, please, Sok?
I think the most important lesson that we can learn is the preparedness of countries to roll out the vaccine. So particularly in terms of planning who would be the first population to receive the vaccines, and second, in setting up our mechanism to monitor the adverse event, report those adverse events, and response to those adverse events.
Thanks so much, Sok. We've had so many questions and we've tried to get to them, as many of them as we can today. We just have time for one more now, but if we were not able to get to your question within the hour, please be in touch with us and we will endeavour to get back to you as soon as we can. The final question that we have time for, again, comes from CNN. I'm going to ask this one to our regional director to kind of cap us off. Do you have a rough estimation of when life will be normal again for most parts of the world? Over to you, Dr. Kasai.
Thank you very much for this question. The answer to this question depends on all of us and the individual actions that we take now and into the future. As I mentioned, that the news of COVID-19 vaccine starting to roll out in the United Kingdom and in USA is a very promising one. But these vaccines, as my colleague Babatunde mentioned, are not a silver bullet and will not mean an end to the pandemic in the near future. The development of a safe and effective vaccine is one thing, but producing them in adequate quantities and reaching everyone who needs them is the another things. Over the next few months, there will be initially only available vaccines limited with the limited quantities, and high-risk group should be prioritized first. For other beyond those high-risk groups, we may be looking for at another 12 to 24 months before the majority of people have received the vaccine. And even that, there is some uncertainty and some unknowns. So this means that, again, tired as we are all to this pandemic, we must stick to the individual actions and behaviors which protect not only ourselves, but also those around us. Hand washing, wearing a mask, physical distancing, avoiding the place with the higher risk. I think it's very important for us to have our empathy and imaginations of the people who have a high risk to these diseases, and then the healthcare workers been working so hard 24 hours, 7 days in the past 1 year. I know this is a very difficult things, but for now, we must keep making the choices that reduce the transmissions of the virus and protect our families and our communities and societies. Back to you, Liv.
Thank you so much, Dr. Kasai. Thanks so much, Babatunde and Sok, and all of the journalists and people around the region who have joined us this morning and the afternoon, depending where you are. Stay safe and healthy. This will be our last virtual press conference for 2020, and we look forward to continuing to work with you going forward. Thank you.